In today's Chronicles interview, I'm talking with Jennie Carreon. She's the Associate Vice President of Civic Engagement at AltaMed, and she's responsible for not only providing people with incredible healthcare, but also showing them how the healthcare system is tied to their vote and vice versa. It's a really interesting approach, and it's showing people not just how to vote and where to vote, but how to vote in line with their interests. She's doing incredible work, and the results that they're getting back is something we've never seen before. So can't wait for you to see this interview, and hopefully how we can emulate practices like this across the country to start getting people involved in their communities and getting involved with voting and everything that has to do with voting. So check out this interview and let us know what you think. Jennie, welcome. Thanks for coming on today.
My pleasure. Thank you for having me.
Of course. We're here today with Jennie Carreon. Carreon? Did I do that right? Yes. From AltaMed. Really excited to be talking with you today about what you're doing at AltaMed. And really just it's such a unique approach to healthcare and to voter engagement and civic engagement. And I've really never seen anything like it. So I'm super excited to have people hear about it. So why don't you go ahead and introduce yourself?
My name is Jennie Carreon, and I am the Assistant Vice President of Civic Engagement at AltaMed. AltaMed is a healthcare organization. We are the largest FQHC in the country, and we have 52 locations in LA and Orange County.
So you and I spoke about this before, and I got really excited because obviously what we're doing at CommonAlly is rooted in civic engagement and also around issues and having people understand how those two things are connected, how to realize your vote actually affects your life and the things that matter. And I think you're doing that so well, especially with the 5-touch approach. Can you talk a little bit about that and what your initiative around that looks like?
Yeah, absolutely. I can talk about this all the time, so thank you for having me. So AltaMed's My Vote, My Health, Mi Voto, Mi Salud campaign is a nonpartisan get out the vote campaign. And the goal is to empower Latinos and low propensity voters who are not contacted by anyone else, who've never been touched or brought into the civic circle or the civic club, and educate them about the mechanics of how to vote. Because what we have found is that when we talk to our community members, our patients about how to vote and the logistics, the answer any questions that they may have on the propositions, they're actually very excited. So the notion that Latinos or low propensity voters are not interested is completely wrong. And we're really excited that this work is proving that. We have been confirmed to be the only healthcare organization doing this level of intense kind of integrated voter engagement work. And we established this model so that it can be replicated, so that other health centers, other nonprofit organizations can see the tools that have been proven, validated, and also implement them so that low propensity voters are no longer in the outskirts, but are also part of the policies that impact them on a daily basis.
Yeah, and you pointed out something interesting, right? And with the Latinx community, I think it's really it's something that people can see every day, and I think this happens in other communities as well. I think there's Native American communities, people of color in general, younger people, people living in poverty. Like these are groups that are deliberately overlooked. So to your point, when it's like, when you actually talk to them, they're excited. They want to get involved in the process. It's just nobody is actually bringing them into the fold. So I think that is that the catalyst? Like, what was that the number one? Like, yeah, okay,
yeah, absolutely,
awesome. And I assume this is probably where you're going with this, anyways. But to talk in detail of, can you walk us through like the minute someone gets into a clinic, right? Like in like this real world, like.
Yep.
Put on your virtual reality goggles and walk in. Like, what's the experience look like?
Yeah, Aaron, and it actually starts before that. It starts when you call in to make an appointment. So you call and you make an appointment. And when you're placed on hold to speak to an operator, on the hold message, there's a hold message on the election. Not to forget that your mail-in ballots are going to be arriving, how many days are left, what some of the propositions mean for you and your healthcare. So that's where it starts. Then you come in to see your doctor. And when you're seeing the receptionist and you're signing in with your insurance information, she hands you a voter guide. When you're waiting to see your doctor in the waiting room, in all of our waiting rooms, there's TVs. So we have a captive audience for about 10 to 15 minutes. While you're there, the TV screens have PSAs that are civically engaged materials. So it talks about the election, how to vote by mail, what do some of the propositions mean. You then go to see your LVN nurse to get your vitals taken, so blood drawn, you get weighed. While you're there with the nurse, there's posters on voting and to vote safe and vote early and make a plan. Then when you see your doctor's vote is wearing a vote pin. Some of them are wearing vote shirts, you see here. And when you leave your doctor's visit, he'll give you a prescription for any medications or hours of sleep that you need to take. And in that prescription, it's the exit plan summary, the patient exit plan summary, and there it gives you, it tells you to vote to protect your health.
Wow.
So voting is actually prescribed as medicine.
It's just incredible.
Yeah.
And I assume, like, your background, you work with the governor and you work with the mayor of LA. So like you have a political background.
Yeah.
Is it fair to say that the reason this initiative was able to roll out like that is because you saw the fusion of politics and healthcare?
Absolutely. And I've been guilty. I've ran campaigns for 20 years, and I've been guilty for only targeting high propensity voters because I have limited budgets.
Yeah.
So when I came to the healthcare organization, and I happened to work for a CEO, his name is Caso de la Rocha, who's a social justice warrior. You know, he's that generation that founded Mecha and was, boycotting for ethnic studies at his university. So when I spoke to him about, this population that no campaign is ever targeting, that even though I would say, when I get this job, I'm totally targeting those folks that nobody else is targeting. At the end of the day, it was $1 and we didn't have those resources. And he was like, wait, no campaign targets them? I'm like, zero. Like, they don't get mail, they don't get, any information. And what that creates is a systematic communities that are disenfranchised, that are not part of the policy or political process. And then I would hear like, but there's commercials playing, right? We all see commercials. There's commercials about, on every proposition on the ads. And I say, yes, but if you are watching a commercial and it's a wheelchair commercial and you're not in the wheelchair business or need for a wheelchair, you just zone right out. That doesn't resonate, that doesn't land. I mean, for you and I, we're like, oh, that was a good commercial, or that commercial is terrible. And we're researching things, but for the majority part of the population, those commercials don't land because they haven't been brought into the fold.
Yeah, exactly. They haven't been brought in the fold. And I think when they are, they're patronized and they're used as like a topical solution to like make something look other than what it actually is. And I think, the major parties are guilty of that, and campaigns individually, commercial, like you name it. I mean, that's what we lived through. So it is actually good now that I think that there's voices around that are actually being heard now. I think there's movements being made around that, and what you're doing with My Health, My Vote is like really or My Vote. Is it My Vote, My Health? Sorry,
Yeah,
My Vote, My Health. I got that wrong. Is really, I think I feel like there is a tide turning there, and that's good because it has to. What are some of the ways that you can take what you're doing at AltaMed? And I definitely want to get into the statistics and the success rate of this because I know it's been incredible. How could other people, some of the ones we just mentioned, take note of this and implement this as well?
Yeah. So before I go there, that was the internal model. We also have an external five.
Sorry. Yeah.
And the external 5-touch model includes us calling low propensity voters in a 5-mile radius from each of our locations. We do that because most of our patients come from a 5-mile radius, and if you live in that radius, then you've seen our ads, you've seen our buildings. We're not strangers to you. So we will call you and say, hi, Erin, my name is Jenny. I'm calling from AltaMed. Just wanted to remind you that we're in election season right now. You're going to be receiving your ballot anytime now. Have you received it? And then you're like, no, I haven't received it. Like, okay, well, is there any topics or issues that you're, looking at on this during this election? And you'll say, number one is healthcare or education. Usually those are the top two. And then Black Lives Matter is also polling very highly with our community, especially our generation Z. And one of the things that once they say that, then we talk about a proposition that impacts them on the issue. And when we do that, we then make a note of that. So then that's step touch one. Touch two, we then go to your house. Hey, Erin, it's Jenny. I'm from AltaMed. And then you'll most likely say, my doctor's coming? Like, is everything okay? And we're like, yeah, no, everything's fine. Your doctor says hello, but she wanted me to come talk to you about this election and what it means for your healthcare and for your community. And then you're like, okay. And they're like, well, and then you're like, oh yeah, I talked to someone. You're like, yeah, you mentioned that education was a big deal. So we really think you should vote yes on Prop 15, because that's going to bring billions of dollars of education resources into our communities. So, we have that touch, and we like, Erin, when are you going to vote? Did you get your mail-in ballot? You say yes or no. So, depending on how that goes, we then target. The third touch is then we send you a letter saying, hey, Erin, we spoke to you. It was nice seeing you the other day. And thank you for committing to turning your mail-in ballot on October 1st, whatever the date that we agreed on. We then send you a text once we check that you haven't turned in your ballot yet. Hey, Erin, your ballot hasn't been received by the registrar's office. Just wanted to see if you have any questions. And then the last touch is we have flex voting at all of at 14 of our clinic sites, where we might get a hold of you and you're like, well, I actually want to vote in person. Okay, great. These are some of the locations. Do you need a ride? Can we pick you up? And it happens to be like the most exciting experience, because the majority part of the folks that we're talking to and that are coming have never voted before. And when we ask them, well, how come this is the first time you're voting, or what inspired you? The majority part of them is like, I didn't know how to, I didn't know, and I didn't know how easy this was, or I didn't want to make the wrong decision, right? I didn't want to make a mistake, or also I didn't want to bother my daughter to take me to the polls, because she's already taking such good care of me, and I didn't want to add something else for them to do. So it's this is like my Christmas. This is like the best time ever. We were just walking in Huntington Park today, which is in Southeast LA, and it's one of those cities that has all of the social determinants of health that impact the well-being of our communities. And knocking on doors, we have 30 organizers knocking on doors, speaking to our community members, and they're so appreciative that we're doing this. And I asked, I spoke to about 6 people today, because I had to come see you. I didn't stay there all night, and the 6 people I spoke to, I asked them, I was like, have you heard from any other campaign? Have you? And 100% of them were like, no, no campaign has knocked on our doors, has sent us any information. Yeah. And the fact that, this day and age, when we have so much at stake in November, and no other campaign is reaching out to low propensity voters and getting them engaged. I mean, both parties, shame on you.
Yep.
All parties, shame on you. It's not just two parties.
Yeah. And what it sounds like too is it's almost like a campaign strategy outside, right? Like a lot of what you're talking about is so strategic, and there's so many moving pieces and follow-up and tracking and all sorts of things that most campaigns want to keep that concealed because of how they navigate in the nature of a campaign. I love that you guys are so outward about it, that you are in their face all the time, because you are a family member, right? You've become this surrogate, like friend or family member. And I think that's important. And that's what's missed, I think, in politics and in healthcare, obviously. But the fact that this is a long-term play, the fact that your impetus is on actually sustaining something long-term and not just putting a Band-Aid on it now, is really what drew us to you guys in the first place, was that someone actually cares. You're going to tell them that, then you're going to follow up with them. Then you're going to hold their hand all the way to the end. And then after that, you're going to follow up again. Right. Like to me, that's the kind of buy-in and trust that people are looking for, and they don't know where to turn to get it because no one cares. I mean, or maybe I shouldn't say that, but at least they haven't woven that into their practices. Right. So it's really nice to see that. And the other thing I just want to like point out about that is, because we're kind of in this space too of being nonpartisan, I think helps as well. And that leads me to like a question I kind of want to ask around this, play devil's advocate a little bit, because we get this pushback as well. Is like, someone can hear what you just said and think that's the greatest thing on earth. And other people can hear that and say, well, they're indoctrinating people, or that's intrusive, or, how could they be nonpartisan if they're talking about ballot measures, or, they're telling people how to vote. I don't believe that, but how would you speak to that?
We can talk to people we can recommend issues. We just can't recommend people. That's like the easiest way for me when I train staff. And some people will be like, tell me who to vote for, and I promise you, it's so hard to be like, like I can't.
Yeah.
Have you seen the news? and also because we're healthcare provider, we take our nonprofit status very seriously. I mean, if we don't, as much as this work is important to me, and I believe in it, and our organization believes in it, protecting our healthcare license is the utmost important. So we wouldn't do anything to put that in jeopardy. As of last night, we've spoken to 254,000 people.
Wow.
And knocked on 54,300 doors. 96% of the people that we have spoken to have committed to vote early and have committed to bring one more person to vote. Now, there's still those 4% that were angry, that were saying, how dare you come, and, everything that you can imagine. But I'll take 94% any day.
Yeah. I mean, in a non-pandemic situation, that would be earth shattering. So the fact that that's happening when you have obstacles in front of you and you could still knock doors and get those kind of results is incredible. Yeah. What are some of the other results, if you don't mind talking about that?
Yeah. So UCLA did a study during our primary work. And they evaluated all of our contacts. They did a placebo, a treatment, and what they found when they evaluated all of our contacts is, let me step back a little bit. Mm-hmm. During the primary election, we expanded our network, so it's not just AltaMed. We brought in, like you mentioned, how do other organizations do this work? We brought in a clinic in San Isidro in the San Diego region. Called San Isidro Health, and Clínica de la Raza up north in Oakland. We wanted to do that strategically, to be in different parts of the state, so that this work can't be said like it's only LA, like only LA can pull this, type of work off. So we did that, and we trained all of those clinic staff. We provided all the materials. All of our materials, our scripts, our texting, our poster, everything is on our website and can be downloaded for free. I really believe that organizations don't have the luxury to have a political strategist on hand. We're a lucky one that we do have that. I have a team that does this work and has been doing this work for a long time. So knowing that, we want to make it as easy as possible. So any organization can go to our website at myvotemyhealth.org and download our materials and put their logos on it. We don't want you to put our logo, because we're not the trusted messenger in your region. You are the trusted messenger. The reason why we're successful in our region is because people trust us. We've been here for 51 years. So UCLA did an evaluation on all 4 regions: San Isidro, Southeast LA, Orange County and Santa Ana, and Oakland, and found that in all of those regions, we had a 12.7 voter turnout increase than any other election.
Wow.
What it also confirmed is that no other research had been done on low propensity voters. So when we're not even comparing apples to apples, because we're comparing our treatment group to high propensity voters. And even with high propensity voters, we voted 12.7.5 higher than the folks that we didn't contact, that our My Vote My Health campaign didn't contact.
Wow.
We had also found is that when we contact them 3 times successfully, I told you there's 5 touches. Not some of those 5 touches, I can't verify, Aaron, that you read the mail, right, that I sent you. I can't verify that maybe one of the calls I just left a message. But when we had 3 successful touches, the voter turnout increase was 17.75. So huge. And as you know, as a campaign junkie, once you get like 4 points or 5 points, margin, you're just like, what? Like, we killed it. This is great. So now having this, this research, UCLA validate this work, I think it's really important to help other organizations feel safe that this work is a good return investment. Because especially right now with the pandemic, we have a bottom line too. Our budget has been slashed, and people don't want to invest in this.
I love what you're talking about with like open source materials and letting communities kind of own it themselves. I think that's really important because, and I want to reiterate what you said, because I want to make sure it like has an exclamation point on it, that, AltaMed in Southern California might work really well. Put that in a small town in Missouri and you're an intruder at that point, so yeah. I think, and that has nothing to do with them understanding AltaMed. It's just because you aren't a part of that community, right? So right. I think it is important to like open source things that work. And I see that in healthcare. I see that in civic tech and in civic engagement. People just, because we have the same end goal, people want to help each other. It's not like, tech proper like San Fran, where everyone wants to eat each other alive to get something, the next unicorn. Right. Because this has impact and nonprofit work woven into it, I think everyone really is more focused on that societal impact. So I think that's amazing to hear. And I wonder if like, I'd like to see this transcend not just healthcare work, but make sure the campaigns are mirroring what you're doing, right? Making sure that commercial entities and I think because social justice now is just, thank God it's not going away, and people are realizing like we need a more just future. Practices like this, I think, are great to emulate. So we will certainly send people that way to look at everything there.
Good. Yeah. And I've been doing a lot of trainings with medical organizations throughout the country. And a lot of them are, obviously want to replicate this. And they, especially right now, right? Because we all feel so like there's so much need to do more. We want, like, whoever is in the nonprofit sector, whoever is in the civic engagement world, we know the urgency of November 3rd. We know it's not just who's going to be president. We know it's, who's going to, be, who's going to protect healthcare for all, who's going to take women's rights, who's going to protect, all of these things that are in jeopardy right now. And it's exciting to see other organizations in healthcare, clinics and hospitals replicating this. And we put like 3 models on our website. AltaMed is like the Costco model, but we also have like the 7-Eleven model, and then the Sprouts model, so that you don't have to do all of this, but everyone can do one thing. If you leave a message on when people are on hold, that doesn't cost you anything, right? Like people are already on hold hearing elevator music. Why not have them hear something? If you download the commercials or PSAs that have already been created, and I had focus group, so this is like good, solid information, then you just have to download it into your system for free, right? Yeah. Like it's like there's systems and there's things that we can do to make sure that our network, our patients, clients, family members show up on November and understand what's at stake.
Yeah, and show up educated. And I think that's the other part of this, is they're coming there with knowledge instead of voting against their own interests, which happens a lot because of the way these measures are written, or because of family influence and lack of education. There's so many reasons that you show up to the poll with good intention and kind of pull the wrong lever, right? So I think it's really important that you guys are providing like the information needed for them to make the educated decision on their own behalf, and not like, I really love that. I want to ask one more question kind of related to the election. Obviously healthcare is your primary focus. What other issues do you see as being really important that either touch healthcare or not? These issues they're not in their own bubble, right? Like the economy touches healthcare, which touches the environment, which
Yep.
so I think everything is kind of interwoven there in that way. But so what do you see outside of healthcare that's like really important that people should be focusing on?
Well, besides voting early, my number one and the number 1.2 thing is filling out the census. The census is going to have implications for the next 10 years. And in LA County, we're only at 65% of completion rate, which
So
means
is
that
that sorry, is that driven by fear? Because I would imagine most of the people who don't want to fill out the census because of all the
Mhm.
press around what they're trying to do in a nefarious way
Yeah,
around the census
absolutely,
and the
absolutely.
crackdown of ICE and all these other reasons where it's like, why am I going to fill out a form from the government right now?
To let them know where I live.
Yeah.
Absolutely, absolutely. So one of the things that we did is we did kiosk at all of our clinics. So I had a promotora station there, and Aaron, when you were waiting there, I would come up to you and be like, Aaron, do you have 7 minutes to fill out your census? And then you would say like, no, I don't want to fill out my census. I don't want to give the government information. And and then we would say, totally understand that. I initially felt the same way. But just like your information is protected in a healthcare organization with HIPAA laws, the census is the same thing. And the census helps fund healthcare organizations like AltaMed. This is why we're so close to your home, because of census numbers and census funding.
Yeah.
And then they're like, well, I don't have a computer. Oh, great. I have a laptop right here. Let's just do it right now. So we'll start filling it out. We ended up helping, Aaron, close to 46,000 people fill out the census. 46,000 people. That amounts to, in 10 years, the amount is $925 million. That AltaMed, just a healthcare organization, has protected $925 million. And when you think of the return on investment, it cost us about $2 million to fund the census outreach effort. Swag, shirts, training, materials, polling, all of that stuff. It costs about $2 million to fund that. But the return investment, $925 million for the next 10 years. So that's the type of work that continues. It's not just about getting people engaged, it's about getting them part of the process, getting them, to come out of the shadows and be part of policies that impact them, like the census. And next year it will be redistricting and then elections again.
Two more quick questions. I kind of want to talk a little bit about, it's in our name. We are CommonAlly. We do truly believe in being able to reach across the aisle and to be able to come together. Like, it's tough to say that in a time when so much injustice is in your face, right? And I'm not advocating for like, well, I'll give them a pass, right? I think people should be held accountable for doing things. But I think, an all blue or an all red situation in a representative democracy isn't necessarily good for anybody. So how do we find commonalities in our communities? And are you seeing that? Do you see people rallying around healthcare regardless of their political affiliation?
I think so. I think we see that. I mean, I strategically worked in 4 locations as a target area that were half Republican and half Democratic. So Oakland and LA, technically the majority part are Democrat voters. Orange County and San Diego, not so much. Very conservative there. But what we have found is that when you're talking to people about issues that impact their families, and more so with with conservative voters, they appreciate that. They appreciate that we're not coming to talk to them about, like, really, are you really a Republican? Like, can we talk about just that right now? Like, how did that happen? I don't say that, but I really think that.
No, and that's the thing too. I think there's a misconception that the Latinx community is a monolith and that everybody's liberal, and like and hardly. I mean, there are some staunch conservatives in the Latinx community, and I think that to dismiss that is a grave error. So I think to approach it in that way is smart, and that's what we've thought from day one too. Is that we have to frame this around issues, and And even in our app, when it's like matching with candidates, you don't see what party they're associated with. You see what they did on an issue, and then you
Right.
either agree with that or not, right? Because that's what matters. Like the
Right.
parties, especially now. I mean, just not to get too crazy here, but I just think the parties are going to be factioned, and it's going to be a different thing in the next 5 to 10 years, anyways. So to attach yourself to a party is just not very fruitful. But so that's
Especially in California, when now,
yeah,
a big chunk are independent voters. So, traditional campaigns are just doing it wrong because they're not even, that's why I think we're also safe. Our campaign is perceived to be really safe and welcoming because we're not shaming anyone for being, team A or team B or team C. We're just saying, look, we see that you're not voting. Let's talk about that. Like
yeah,
what's happening, or how can we be of service? And let me tell you what's at stake for you. We're not talking, like, even with the census, all the materials around the census talked about congressional seats and billions of dollars. My patients don't have that luxury to think about a congressional seat or billions of
yeah,
dollars. But you know what they have the luxury to think about? Healthcare, Medicare. They have the luxury to think about, oh, this affects lunch tickets for my children, or this affects my Section 8 housing. So when you talk to someone where they're at and in plain English, people are interested in this. This is for our future, for our community. Absolutely. Count me
yeah.
in.
I always wondered why politicians who are running, to look at the current race, at the top of the ticket, why they're not saying, yeah, say vote for me, obviously, but also vote down ticket, like
Right.
vote school board, vote like all the way down. Like,
Supervisors, right.
yeah, just, because this not only helps the campaign and everything they're going to want to push through, but like it's really letting people understand politics locally and like how it actually affects them. And I think people can rally behind that more so than I like Trump or Biden. Like that feels so distant from people. I think that's why a lot of people disengage. So it's always blown my mind that no campaign out of every breath that comes, right?
Yeah. Well, I
Um,
think it's also economics, Aaron. The people that are running campaigns, and I've been guilty of this in the past. We want to get on different tickets. We want to get on different budgets.
yeah,
So, it has a lot to do with economics as well.
of course. Yeah, no, I understand that. And I think but when you have the society kind of swelling up and the people actually grabbing that microphone back, you're not able to do that anymore.
Absolutely.
Right.
Right.
Um,
Absolutely.
I'd like to kind of end with a bit of a PSA, but just kind of what, our demographic is primarily Gen Z. It's young people. And, you know, I'm a broken record. So if you've heard this before, you can block your ears. But, young people don't have mortgages traditionally anyways. They're not married. They don't have kids. There's not a lot of skin in the game. So they don't feel that elections and that issues really touch their lives sometimes. Um, and I think this generation, more than any I've ever seen, is more in tune and sees that there's stake there, regardless of those things I just mentioned. What do you say to them, to that specific demographic, about the importance of this election and the importance of voting?
This generation has given me the most hope.
Yeah, same.
It has just been like so amazing to see them stand up and be so vocal and loud and active about things that are unjust and fair, and saying this is not a race issue, this is a racism issue. Them calling it out. And
Yeah,
it's just, as a lifelong organizer, I'm just so proud of this new generation. And I mean, to what you say is that, yes, they don't have mortgages, but they're going to. They
yep,
don't have children, but they're going to. What happens today, there's been 194 judges appointed as of today in the last 4 years.
yep,
They're going to be appointed for the rest of their lives. So that's going to impact your future choices, your children's future choices. And they're smart enough to know that. I think actually, I know that they're smart enough to know that, because that's why they're up in the streets and demanding for police reform. And, my big thing that I tell my younger cousins and our younger staff is, you want really real reform, is show up to the polls, that in huge numbers. That's going to show up. That's louder than protesting something. Protest something, in the polls, and not just you by yourself. Collect the ballots from all of your family members. Take them all in together. Have a voting party. Be aggressive. Be as assertive and aggressive with this because the next 28 days are going to be challenging. And there's going to be a lot of rhetoric coming towards all of us, especially them, that is going to be full of lies. So they have to just keep on task. This pandemic has shown us an amount of discrepancies and unjust and inequalities at a next level that I don't think any of us have ever been prepared for. And because of that, and because we're healthcare providers, we think, and we keep on telling everyone that, especially in the era of sickness, voting is medicine, because your life really depends on it.
I love that. That's awesome. That's yeah, we're gonna use that one. Very great point. And honestly, I can't thank you enough for coming on and you know, having this, the story of what you're doing is really important, and I'm glad that people are here for it. So anything else you want to share before we get going here?
If you haven't received your mail-in ballots, call and find out where they're at. You can register at the Secretary of State's office to find out where it's at, just like you would track a FedEx box. So that's the first thing I would ask all of your listeners to do.
Great.
Thank you.
All right. Well, thank you. And anytime you want to come back, we'd love to have you. I think we're going to be doing like a healthcare week right before the election. So we'll probably have you back on. And yeah, I really appreciate your time.
Yeah, if you ever want to come check out how the model works in our clinic and see it, and or go walk some precincts with us, it's my favorite absolute thing to do. So I always welcome and try to entice other folks to join me as much as possible.
I would love that. Maybe we'll document the whole process and show everyone. I would love that.
Perfect. Okay.
Great.
Thank you. All right. Have a good day.
All right. You too. Thank you, Jenny. Take care.